Okay, welcome to today's presentation. My name is Nasiru Elik Murishid. I'm a clinical nutritionist and a dietitian. Today we are going to see our presentation on concept of peptic ulcer disease. In peptic ulcer disease, we have got two presentations, the first one and the second one. Therefore, it is better to follow and to listen and to attend all presentations so that we get a lot of concept and knowledge on peptic ulcer disease. Okay, peptic ulcer disease, actually peptic means the stomach, ulcer means the breakdown or lesion and ulceration of the stomach. The peptic ulcer are often sores that develop on the inside lining of the stomach, the upper portion of the small intestine, and in the esophagus. The peptic ulcer, the lesion that occur mostly in the stomach, in the small intestine, or mostly the upper part, the duodenum, but also in the esophagus. The gastric ulcer, the peptic ulcer are divided into three parts, which in the esophagus, in the stomach, and the duodenum. The ulceration occurring in the esophagus is an esophageal ulcer, but also an esophageal ulcer. The ulceration that occur in the stomach is the gastric ulcer, but also the ulceration that occur in the duodenum is the duodenal ulcer. The duodenum is the part of the small intestine that found in the upper part near the stomach. Our stomach has divided into four parts: the cardia portion, the fundus body, pyloric and pyloric antrum. In the cardia, we have epithelial layer that consists of gastric gland. Epithelial layer that the cardia has epithelial layer that consists of gastric gland. The gastric gland has the fibrous cell. The fibrous cell which secretes mucus, the mucus which composed of water and the glycoprotein. But also the other part we have the fundus and the body. The fundus and the body has parietal cell that secretes the hydrochloric acid in the when there is a presence of food. But also the fundus and the body has the chief cell which secretes the pepsinogen, which are in active form found to be pepsin, which help in the digestion of protein. In the pyloric antrum, we have the G cell. The G cell secrete the gastrin. The gastrin, which are being secreted in the pyloric antrum, help in the what? Help in the increase of hydrochloric acid production by the parietal cell. But also the D cell found in the duodenum and the pancreas. In the duodenum and the pancreas. But also in the duodenum we have the Brunner gland. The Brunner gland secreting mucus which are rich in bicarbonate. The bicarbonate and alkali that is the base which help to neutralize the acidity from the stomach. That means if the chyme from the stomach have low pH, therefore when reaches in the duodenum has to rise in its pH through the aid of of bicarbonate ion which are being secreted by the Brunner gland. Therefore, that is about the peptic ulcer and the part of the stomach we have and how the pH changes from the stomach into the what? Into the duodenum. The ulcer, an ulceration can be over, or we can see an ulceration by using endoscopy. Endoscopy, that is EGD. For here we can see the normal stomach, and here we have the gastric ulcer. It is seen here by utilizing an endoscopy. This is the stomach. This is an ulceration here. These are ulceration on we can see here, and this is an ulceration in the endoscope. Yes, but it is important to note that the duodenal ulcer are more likely to occur than gastric ulcer. The duodenal ulcer, the ulcer occurring in the duodenum, are more likely to occur than the ulcer in the stomach, and the duodenal ulcer are more likely occur in male than female. It is important to note about those things. That is the general overview of peptic ulcers. Let us go and see an etiology of peptic ulcers. The etiology means causes. Here we have two most common causes. The first one is a Helicobacter pylori infection. Helicobacter is the bacteria that colonizes the gastric, that colonizes the stomach. Is the gram negative that colonizes the gastric mucosa and releases adenosine that help to bind to the what? To the mucosa lining. But also this Helicobacter has protease that damage the mucosa cell. Once damage the mucosa cell, they causes lesion or burrowing into the what? Into the mucosal lining. Through creating those environments, and inflammation can occur there. And the prolonged inflammation caused by the Helicobacter pylori, prolonged inflammation can lead to ulcer. But also we have medication. The medication here specifically non-steroid anti-inflammatory drug. The non-steroid anti-inflammatory drugs are used mostly for relieving pain, inflammation, and reduce of the body temperature. This non-steroid anti-inflammatory drug has the property of inhibiting of cyclooxygenase enzyme. The cyclooxygenase enzyme is involved in the synthesis of prostaglandin. The prostaglandin, which are being secreted in the stomach and duodenum, which stimulate mucus and bicarbonate secretion. Therefore, the utilization of non-steroid anti-inflammatory drug goes to inhibit an enzyme that used to synthesize the prostaglandin. Therefore, if there is no prostaglandin in the stomach, there is no mucus, there is a decrease in mucus secretion and bicarbonate secretion. Therefore, even also this prostaglandin involved in vasodilation for increasing the blood flow to the stomach to neutralize the acid. But also bicarbonate is an alkali, is the base. Therefore, help in neutralizing the hydrochloric acid. Therefore, the prolonged prostaglandin absence. If there is prolonged absence of prostaglandin, we will have decreased the mucus secretion and the bicarbonate, but also reduce the blood flow to the what? To the epithelial lining of the what? Of the stomach. But also hydrochloric acid will increase to be secreted. Therefore, it is important to note here These non-steroid anti-inflammatory drugs inhibit the prostaglandin synthesis by inhibiting the cyclooxygenase enzyme. That is prostaglandin non-medication how involved in the what? To cause the peptic ulcers. But we have other etiologies as the physical stress, as head injury and burns. We have hypersecretory state. The hypersecretory state, here we can see the Zollinger-Ellison syndrome. The Zollinger-Ellison syndrome are caused by gastronoma, the neuroendocrine tumor located in the duodenum, and the secret abnormal of gastrin. Here in the Zollinger-Ellison syndrome, there is increase in hydrochloric acid secretion which overwhelm the defense mechanism and allow an ulcer to develop in the first portion of the duodenum. This Zollinger-Ellison syndrome mostly occur in what? Are seen in duodenal ulcers, in which there is a high secretion of hydrochloric acid, but also there is inhibition of gastrin. The gastrin which, there is stimulation, abnormal stimulation of gastrin, which increases the production of hydrochloric acid by the parietal cell. Therefore, is among the causes, but we have to note the important major causes: Helicobacter and medication, non-steroid anti-inflammatory drugs. But we have influencing factor as alcohol and smoking. The alcohol irritate the mucosa lining, but also smoking impair healing of the ulcer. It is important to note this alcohol and smoking are influencing factors for a one who already developed a what? An ulceration. But also through clinical presentation, we have dyspepsia, the most common symptom. The most common symptom is dyspepsia, the gnawing, burning or bloating sensation, mostly in the epigastric area, the epigastric pain. But also we have abdominal fullness, satiety. The abdominal fullness we will go to see on the differences between the duodenal and the stomach ulcers, on how abdominal fullness where it work. But also satiety the same, but also nausea and vomiting of blood. These are mostly seen for the patient with an ulcer which have deep an ulceration of the mucosal lining. But also we have loss of weight. The loss of weight mostly occur for the patient having the gastric ulcers, and for weight gain occur for the patient who have duodenal ulcer. Here are duodenal ulcer indication. Epigastric pain occur 1 to 3 hours after eating. This we will go to discuss in the next session, where we are going on treatment. We will go to study deep on epigastric pain and duodenal ulcer and the gastric ulcer. We'll go to see more there. But here, as we look on overview of these, relieved by eating and the antacid, period of symptoms alternate with the period of remission, but also may interrupt sleep, also associated with weight gain. But also you have complication associated with this. The first, we have bleeding, perforation, gastric outlet obstruction, and pancreatitis. We have through diagnosis. The diagnosis, we have esophageal duodenostome, but also we have gold standard. Through the diagnosis we have esophageal EGD, esophageal gastroduodenal duodenoscopy. This is the gold standard and the most accurate method for diagnosis of what? Of the peptic ulcer disease. Is how do we see here an ulceration in the what? In the of the peptic ulcer disease. This is the normal lining, but here this is an ulceration, and here can be viewed well. But also we can assess the peptic ulcer disease by assessing for Helicobacter pylori infection. Through Helicobacter pylori infection, as how I told you, these are gram-negative that most colonizes the intestine. Sorry, not the intestine, the stomach. That colonizes the stomach. During the increased pH, these Helicobacter pylori are found to multiply, to increase in their number. Therefore, these Helicobacter pylori infection can be used in diagnosis as through serology. The serology, we have antibody-antigen interaction, antibody-antigen reaction through serology. Therefore, here we are utilizing the antibody to see the Helicobacter pylori by utilizing the blood. Since the Helicobacter pylori causes an ulceration of the mucosal lining and may burrow into the what? Into the lining, to the blood capillaries, to the what? To the circulation. Therefore, we can utilize the serological test to find the what? Helicobacter pylori. But this method mostly are seen to occur for during diagnosing the patient or an individual who already exposed to Helicobacter pylori infection. But also stool antigen testing. The stool antigen test is used for testing the current infection. That means the patient is exposed to, has contained the Helicobacter pylori in the stool. When being given the drug or medication later to see an outcome also can be done again in order to see if the antigen are found in the stool or not found. But also we have barium swallowing. The barium swallowing is an alternative for what? For esophageal duodenoscope. The esophageal gastroduodenoscope, which are being inserted through the mouth, in the esophagus, the stomach, and the duodenum for diagnosis of an ulceration. Let us see on the treatment. The treatment of peptic ulcer disease, it depends on causes. We are treating the peptic ulcer disease by seeing first on the causes, by determining the etiology as the key to remove the causes. We can utilize three methods: the surgical method, medication, and therapeutic. The surgical method is done for the patient who have very deep an ulceration. For patients having deep an ulceration, those who have very deep an ulceration, that an ulcer or lesion has damaged the epithelial lining, of the stomach, and entering deeper into other tissues. It is where a surgical management can be applied so that to treat the patient. But also we have medications. Through medications, I will not go so deep here. We will go to see more in detail on the therapeutic treatment. Therapeutic treatment is an our part through peptic ulcer disease because as you know, the food is medicine. The food is medicine. Also, here an antibiotic we are using the antibiotic against H. pylori bacteria as amoxicillin, clarithromycin, and tetracycline. But also we can utilize acid lowering medication. Here we have proton pump inhibitor that function on lowering acidity of the water of the stomach, as we have omeprazole, lansoprazole, rabeprazole, and pantoprazole. Those are surgical and medication on how we can treat the patient. In the therapeutic treatment, we are going to see it in the second presentation. Please be with me so that we get a lot of information and more understanding on peptic ulcer disease. It is true, food is medicine. My name is Nasir Eric Morishidi. Thank you for listening, but please like, share, and subscribe my channel so that to get more earning and to get more advantages. Thank you.